Today on Sauna Talk, we welcome a very special guest, Dr. Hans Hägglund. Who is Dr. Hans Hägglund? He is a medical doctor and professor at Uppsala University in northern Sweden. Professor Hägglund has a strong research background in clinical research within medicine. He graduated from Karolinska Institute, Sweden, and did his postdoc at Fred Hutchinson Cancer Research Center in Seattle, USA. Between 2013 and 2018, he served as the director of Cancer Center at Uppsala University Hospital. Professor Hägglund also had the position as the National Cancer Coordinator at the Swedish Association of Local Authorities and Regions, SALR, between 2019 and 2022. He currently holds a position as senior consultant at Karolinska University Hospital in Stockholm, which is where we catch up with him for this episode of Sauna Talk. And on this episode, we recognize that Dr. Hans Hägglund is a man who wears many hats in the world of health, wellness, and sauna culture. Hans is an affiliate researcher at the Center for Resilient Health at the Stockholm School of Economics and co-founder of Vision Zero Cancer in Sweden. Known by many as the Sauna Doctor, he serves at the Swedish Sauna Academy, sits on the board of the Sauna Research Institute and the International Sauna Association, and played a key role in organizing the International Sauna Congress in Haparanta, Torino, back in 2018. His book, The Sauna Book, Hot Facts on Sauna and Health, published in Sweden in 2020, has attracted wide attention for the way it bridges science and tradition. We explore why sauna and cold bathing are seeing a surge in global interest and what challenges remain in researching their health benefits. Hans shares his thoughts on why sauna bathing should be considered alongside traditional medicine and gives us a glimpse into the new book he's writing and reflects on how prevention can be far more cost-effective than treatment. Along the way, we discuss his professional journey, the boards he serves on, and even his earliest sauna memories. And of course, we'll hear his take on one of my favorite questions from a Swedish and global perspective. What's the most misunderstood thing about sauna that he wishes more people knew? Let's welcome Dr. Hans Hägglund to Sauna Talk. Greetings. This show is brought to you by Sauna Build, Start to Finish. This is a book that I wrote in 2013, now in its fourth edition. It's for the DIY sauna builder, the casual sauna builder. You may be an accountant, you may be a lawyer, you may be a father, you may be a mother. This is a slow and steady approach to sauna building, from start to finish. We go through Finnish rules, British diplomacy, American adaptability, and bring you a full spectrum guide to building your own sauna. Indoor electric, outdoor wood-fired. We cover it all. Just keep in mind the Holy Trinity: heat, steam, ventilation. We get those three covered, you're on your way to building a great sauna. To order the book, go to saunatimes.com. Up at the top, click ebook, and get your copy today. It's sauna time. Welcome to Sauna Talk. We are with Dr. Hans Gustav Hägglund from up in the north region of Sweden. Is that where we find you, Hans?
So no, I'm living in Stockholm. It's not north. It's in the lowest third part of Sweden. It's the capital of Sweden, close to the sea. So no, I'm in Stockholm actually.
Oh, you are. Okay. Are you you're in your city house or your summer house?
No, so today I'm in my apartment in the city, but I just recently came back from the summer house. I'm on holiday now, so
Great. Well,
planning
congrats.
planning planning actually an interrail tomorrow. So we are leaving for Germany tomorrow.
Oh, you are. Okay. How long will you be down there?
So we will be there for 4 or 5 days, and then traveling to Switzerland to celebrate their National Day on August 1st, and then we will go by the Mountain Express train into the mountains and do some hiking in Switzerland as well.
Oh, that sounds wonderful. I have Euro envy of how accessible different countries and different topographies are. I love the topography in Sweden where you live. Is your country home or your country place? Are you by a lake or by the sea?
So the country house is by a lake. It's the third biggest lake in Sweden, and that Lake Mälaren, it's actually connected to the sea, so you can go out via different locks.
Wow, fantastic. Let's for listeners, let's start with your professional background. Tell us about you as a professional, as a healthcare professional, and what your role is
Yes.
and your background.
Okay, so I'm a physician and researcher within the medical field. My profession is as an hematologist, so I work with hematological malignancies, mainly leukemia, lymphoma, and so forth. And what I do is I do blood stem cell transplantation and cell therapy at Karolinska University Hospital. But I also have my professorship in Uppsala University and was graduated from Karolinska Institute, and I also have had different leadership roles in the healthcare sector in Sweden, and most recently I came from a role as the national cancer coordinator in Sweden.
And that's where I had northern Sweden on my mind is Uppsala University. Are you still doing professorship up there, or is most of your time spent in? Okay.
So I do my clinical rotations at Karolinska University Hospital, but the research is based in Uppsala. But I'm mostly in doing clinical rotations actually. So I have the fortunate to be part time off work for doing other things like sauna. So I work half time approximately, and then I have some I do things that I love. So
Love it.
I have that advantage.
Yeah. Is it difficult for you? Is it taxing, being that your main work, half of your work is within cancer and stem cell? Is it inspiring on a personal level? Is it sobering? Is it sad? How does it affect you personally?
I've been working with patients on and off for almost. I graduated 35 years ago, so I've been, working many years with patients, and, doing that, I would say that I have become, a better physician, I would say, and, it give me so much to work with the patients, and it's actually worth spending every minute with the patients and doing the difference, and getting older, it's more. I feel more comfortable talking about other things in life, not only the bad situation with the diagnosis and treatment, but also talk about other things that could help patients, in life, and
Yeah.
being a collaborator more, and guide through this difficult situation. So I love it, actually. I really do.
Fantastic. Is sauna part of the treatment for cancer patients, or is there a firewall up between your love of sauna and research with sauna with cancer, or is there an overlapping relationship between these two things in your life?
No, it's a good question, because it's not integrated in health, in Swedish healthcare, sauna treatment, or heat therapy or cold therapy. I would say that when it comes to complementary or integrative medicine, we are very. I would say we haven't come that long, actually. So I would say that physicians in general, in at least in Sweden, are a little bit afraid of going outside, the comfortable zone with the Western medicine. And but who knows in the future? Now we know that it's good with physical activity. We know that it's very important what you eat and how you sleep, and all that stuff. And I would say, and visit the nature, being in the nature, the forest, and this is more acceptable today. So I think it's a gliding scale in some way, that in the future it might be so that you go for your chemo or stem cell therapy, and then you do physical activity, and you're also doing heat therapy or cold bathing, because there are so many physical and mental advantages with sauna bathing. And why shouldn't that be true also if you have cancer? I would say if we have this talk 10 years or 15 years from now, it might be integrated, but it's not today, actually, not in Sweden at least.
Sure. No, understood. We can come right back to this, but I thought for listeners it would be nice for them to get a little bit of understanding about sauna or badstu, sauna culture in your country of Sweden. You share quite a large border with your neighbor Finland. I just got back from Norway recently and just published a Sauna Talk from Oslo with the Oslo Badstu Flooring Group. Do you know about them, Hans, the Oslo Sauna Association and the floating sauna scene in Oslo? Are you familiar with what's going on to the west of you?
Yeah, I am, and I was actually in Norway a month ago, and gave a lecture on a culture festival in Drammen. It's a little bit north of Oslo. Yeah, I know this, and it's so fascinating, because traditionally Finland and Sweden have been the bastu or sauna countries, but the interest in Norway is growing so fast, and they are doing so much good thing with the sauna. And I think that the community and the politicians, they are actually they understand the value of this, and they are they are positive to build saunas on those floating docks and boats. And it seems that it's not that regulated as it is in Sweden. I mean, you need a lot of licenses, and it's hard to put floating sauna in the lakes in Sweden because of the regulations. But I think this is also slowly changing now. There is actually in Stockholm now a sauna coordinator employed, actually, to try to make it easier to start a sauna organization or sauna club or sauna boat or so. But the Norwegians have really been successful in developing the sauna culture. It's fast, and if you look at the architecture of the saunas, it's amazingly cool buildings, and I really like that actually. So I would say that it's growing fast in Norway. It has always, because they haven't had this tradition as Sweden and Finland, and also Denmark it's also growing in. The interest is growing in Denmark as well. They haven't had the tradition either, even though it's close to Germany, where sauna is so big. But Denmark and Norway, they're really coming now.
Fantastic. And you have a perspective on this because of your involvement, well, for for multiple reasons, but tell us about your the boards that you sit on, and how that can give you some special insight as to other countries and, Batstu and how sauna works in those countries compared to your country in Sweden.
Yeah. So I'm in 3 different boards, sauna boards, and one is the Swedish Sauna Academy, which was founded in 1988 by a couple of elderly men that they went to a sauna in the northern Sweden, and they said, "Wow, this is shit," and they said, "We need to to spread a good sauna culture." So they started this academy, and I became a member many years ago, but in the academy. But now I'm in the board since 10 years or so. So what I do in the board is that I try to take care of everything that is related to health care, and we had the advantage to host and organize the International Sauna Association meeting in 2018, and this meeting is held every 4th year, and last time it was 2022 in Germany, and 2026 next year actually Oslo is hosting and arranging this meeting, and I have been on pre-meetings, and they are planning. I would say that this will be something special, really special, and if you have the chance to visit Oslo in September 2026 for this International Sauna Association meeting, you should go actually, because it will be a lot of talks, it will be a lot of social activities, a lot of sauna bathing. So yeah. So I'm in that board, and we are as a academy, Swedish Academy, we are members in the International Sauna Association, where I'm also on the board, and with the same role, trying to give information on health issues when it comes to sauna, and also in trying to via ISA to start research, and I'm also in the SRI, the Sauna Research Institute, which you know a lot about, and we are trying, I think, also to get people together now and start collaboration and spread the knowledge about sauna and health, but also try to get together to do sauna research, because it's not that organized yet, and I think we can, together with International Sauna Association and SRI and the different institutes, universities around the world, start a collaboration and also meetings for sauna researchers, and try to develop standardized protocols, and also try to find funding for research, which is for the moment a challenge, actually, I would say.
Right. So just to jump in summary, the life of Hans, half doctor with stem cell cancer, leukemia, other half, you're free to do your other passion, sauna. Okay so far?
Yeah, that's fine. That's a good summary.
Yeah. Okay. And then this other half, which excites listeners and myself, of course, is I look at your other half as 3 board positions: ISA, the International Sauna Association, and then the Swedish Sauna Academy, which you've been a member of for quite some time, and the Sauna Research Institute. So those 3 board positions. Did I get that right?
Yeah, that's right. Yeah.
Yeah, cool. And yes, for sure, this by the time this podcast launches, it'll be about a year away. A year and a couple of months will be Oslo for the World Sauna Congress. And what a neat thing to be thinking about, you being a part of that Congress and really wearing 3 different hats, the 3 boards you sit on. Can we speak about each of them? You spoke a little bit about SRI, and maybe we could stay with Sauna Research Institute for a moment. I think we share this. The word silo comes to mind. Silo. I think from a researcher perspective, and what we've been able to perceive, you and I, is that researchers have a like-minded intent to advance accredited research that is peer-reviewed for their work. And what's really cool is people come at this idea of sauna bathing being a healthy practice, a healthy thing we do. But it's kind of neat, isn't it, to see people, researchers come at it from different angles. Do you want to speak to that a little bit from your perspective, from an SRI perspective and as a doctor? What are a couple of three or four or 2 or 3 examples of research that you have seen or that excites you that other researchers have a passion and a lane toward studying?
Yeah, but that's interesting. I was thinking about SRI and why it's important, and I think it is important that we collaborate, because there is so few that actually do research on heat and cold therapy, and therefore I think we need to get together and to exchange knowledge and help each other and also create a platform to meet, to exchange this experience, for example, on an annual meeting, and try to make an organization that can help each institute or researcher to improve and to collaborate. That's one thing, I think. And since they're going into the sauna, you can do it in so many different ways. I counted in the literature how many protocols that have been used, and it's more than 100. You can have 50 degrees, you can have 60, 70, 80, you can have different humidity, you can be placed on the lower level or the upper level, you can stay for 1 minute, 5 minutes, 20 minutes. You can shower or take a cold bath in between, and you can do this every day. You can do it every second day, or once a week, or once a month. So when you add everything up, you have so many different protocols, and that's why it's important to standardize those protocols. So if we do research in Japan or US or Sweden, that we try to do it in the same way. And this is one thing that I think it would be need to meet and to discuss how can we do this in a way that so we can compare our results and do this more organized. So that's the second thing, I think, to have those standardized protocols.
Great, great.
And yeah,
With that is supporting each other too, supporting each other
exactly,
with
yeah,
protocols. Yeah, good. And you were
exactly,
going to say
yeah.
something
And you
else?
can no, yeah, I mean, because then you can be in an institute, for example, in, let's say, in Switzerland, and you have a close collaboration with cardiologists, but you can be in Sweden, and in at that site you have a close collaboration with dermatologists or skin doctors or whatever. So
Mhm.
that's a way to help each other to improve and to develop research, and I think that's a very important thing that SRI can help with, and also the founding part. That we try to convince the wellness industry, because when I do research, let's say for medication, for a new drug, then the pharmaceutical industry, they pay a ton of money, to get this through and to show that
Mhm.
their drug is better than another drug. But
Mhm.
there's no one, interested in today in found or put money into sauna research, because there is no one there out there that have those money. But I think the wellness industry might be an important player here, that can help us to do research, because this costs money, and then we need help from I would say that the wellness industry, and that the results will help the wellness industry,
Yeah,
to to expand and improve,
love it.
and it will
Yeah,
be
so it's
good for them
yeah,
as well. So yeah.
agreed. It's like SRI could be what SRI is a flywheel to help move these things along because you have a researcher wanting to do a study, but there's no
Hmm.
funding, and then there are funding opportunities through the wellness industry, but they don't have
Hmm.
accredited place to allocate. And so
Hmm.
connecting these dots from researcher to
Exactly.
funding
Yeah.
is critical, right? And then you also spoke about, I guess I could say, facilities. It is nice that, and you use this example where if there's research happening in Japan, there's research happening in Sweden, some common, even as simple as language. Fellow board member Eric Lee talks about, well, what are we going to call this? And the
Hmm.
accepted term is sauna bathing. Like, we are going
Hmm.
to do research on sauna bathing. Well, I know that sounds so basic and simple, but really that's a starting point, because there are other forms of sweat therapy that can be researched and should be researched, but let's at least agree on language, and then also the facility in which studies happen. So do you have any comment to that?
Yeah, no, I totally agree. So it's not only to standardize protocols; it's also to standardize the language, because so we know what we are doing and what we are evaluating. So no, I agree with Eric completely, and standardization is the first part. I mean, because this is it has been research has been done for many years, but when it comes to sauna bathing, but it's not standardized, and we need to speak the same language, even though we are
Hmm.
in Japan or Poland. So yeah, for sure, it is of importance. And as you said, I mean, heat therapy could be a sauna, but it could be a hot tub as well, and also very many that go into the sauna, they actually do contrast therapy, because when you go from the sauna and into a cold shower or a lake, and that also needs to be standardized, or you need to use the same terms. What is contrast therapy and what is cold bathing? Because we are now trying to submit the paper on cold bathing, and the reviewers, the first thing they ask is, what is cold bathing?
Hmm. Mm-hmm.
You know,
Yep.
there is
Start
no
with the
one can
foundation.
ask.
Yeah.
Yeah, we need the foundation. Yeah.
Love that. Right. And so switching gears a little bit here, when it comes to healthcare, and this is, I think, a little bit more, well, it relates to certainly your role within SRI, but you've been a champion about how prevention is so much cheaper than treatment. Can you expand on this? Your belief and your philosophy of this?
Yeah. Thank you for asking. I mean, this is a really important question, and as we are approximately 10 million people living in Sweden, and the cost for healthcare is around $50 billion, if I get this translated in the right way. So, it's a lot of money that goes to healthcare. And today we wait until we get sick. So with age, we will have our myocardial infarction, or we will have our cancer or heart failure. And then we visit the physician, and then we get a ton of pills. And we know today that those chronic diseases, for example, cardiac diseases and lung diseases, those chronic diseases, they actually stand for approximately in Sweden, 80% of the healthcare costs. And you can today prevent 80 to 90% of all chronic diseases. So if you if you live your life with good, if you have the right lifestyle factors, for example, you're a non-smoker, very limited with alcohol or no alcohol, and you do your physical activity, and you keep an eye on your weight and all, what you're eating, then those factors in major studies shows that if you have those four factors, you live approximately 12 to 14 years longer compared to those that the persons that smoke, drink, have a little bit overweight and are physically inactive. So we know that we can prevent 80 to 90% of all chronic diseases, which means that we can reduce the cost for healthcare with a lot of money. But we are only putting 3% of our healthcare cost in prevention. So I think we have to think in a new way, that we need to prevent diseases so we can pay for the fast development in diagnostics, in new treatments, in for example what I'm working with now with cell therapy. So that's my take on this, that we have to work with. And what is prevention? Well, I mentioned those four big things, but it's also that being out in the nature, it's sleeping well, but it's also heat and cold therapy. And because today we live in it's daylight 24/7. The climate or the temperature is almost the same wherever we are, and we are not built for a constant therapy or light 24/7. So and we are now today we also we have all this with the digitalization, we are and social media and so forth, we are very stressed, and stress is a major risk factor for diseases, and we need to think about how we live our lives, I think, much more, and then we can be. This is a little bit it's close to, you know, what is called longevity, but I don't really like that term. But we need to live our lives so we will live longer and live with high quality of life. And then there are different things to do this, and one which I am so interested in is heat therapy and cold bathing. And I think if you ask people that go into the sauna or go into the cold water, they actually report much better mental health. And we know now with studies performed that, you know, you can prevent cardiac diseases, and you can prevent death by cardiac disease up to 50% if you go into the sauna regularly. So it's so much to do here, I think, and to spread this information to the population that this is a good thing, actually, and this is what ISA can do, but also SRI, and we can spread this, you know, out to the people, and by doing this, we need research. We need to show that this is effective, and how should we do and to make it even more effective. So research is the ground here, the fundament to spread this information in a right way, I think.
Beautiful. Thank you. Thanks for that. And this thing we do, this contrast therapy, sauna and cold, it's really accessible and simple. I mean, this is not elaborate apparatus and medical equipment. This is common stuff that, you know, we can, you know, I'm a sauna builder, and I wrote a book on how to build a sauna, and, you know, the fundamentals, like the more elaborate, the sauna building becomes, the more I appreciate the simplicity of sauna, the heat source, the rocks, the steam, ventilation. You know, the best saunas I've been in, arguably, you know, are the simplest in construction, and they don't need to cost the better part of an annual wage. We can achieve good heat and cold in a very accessible way. So I think that's exciting for the future of sauna bathing as well, is and you don't have to own your own sauna as well. And you talk about the, you know, the communal aspect, and, you know, the idea of getting off your cell phone and stuff. The idea of a community sauna, or a sauna within a small town at a gym, or you know, a community center. There's just a lot of potential for the availability for more sauna bench, no matter what country we live. Would you agree?
No, I really agree, because it's inexpensive. I mean, you can jump into a lake or a river, I mean, almost everywhere. But, and you can also, you know, in at least in Sweden, it might not be so in all countries, but we have the community bathhouses, which are actually, it's quite cheap to go into this, because it's subsidized by the community, and I would say that also a lot of gym today have sauna, and but not all of them, but in at least in Sweden, you know, the big gym have those, and even the small ones, and the community bathhouses. So it is so easily accessible and cheap, actually. So yeah, this could also be, when I'm talking now, I'm out of the top of my head, I was thinking that, you know, SRI or ISA can also work with countries that cannot, you know, cannot, what is the word in English? They cannot not offer this for the population, because I would say, you know, a small, in each neighborhood, it should be a small sauna, you know, for easy accessible for people. It could be, in hundreds in a city. Just a sauna,
right.
so you can meet, you can read your papers, you can talk with other people, because loneliness is also, it's also a risk factor for many diseases. And
Mhm.
at least in Sweden, loneliness is so common. It's more and more common. And we can prevent loneliness by putting a sauna in the neighborhood, that where people can meet. And there is something happens in the sauna, because when I go to the gym and in the locker room, you get rest and you don't talk that much, according to my experience. But when you go into the sauna, you start talking, and the discussions I have had in the sauna, they are so interesting, and you get to know people and you make friends. I mean, as you know, we have been talking about sauna. It's our common interest, and when you have an interest in something, it could be stamps or cars or whatever. But when you belong to that part of a community, you will have new friends, and I would say that sauna bathers are really really nice people, really nice people, and if you haven't met those people, go to a sauna and you will find new friendship, I would say.
Beautiful. So a leading question, but does sauna attract really nice people, or do people become very nice because of sauna? I mean, is it a little bit of both, or because I know exactly what you're
Yeah.
saying. If you had to guess, what would you say to that?
So I would say that this is something that is an interesting research question, actually. I don't know, no one can answer that, I would say, but it could be studied.
Mm-hmm. Beautiful.
Because is there something, is it a social interaction? Is it the because that you're a nudity, or is it something with is it a hormonal thing, or I don't know. I don't know,
Yeah.
actually,
No,
and nobody knows what I.
it's very
Yeah.
good. It's and there is this. We go on a journey together. We show up, we take our clothes off, we go on to the bench, and
Hmm.
we go through this process together. And I think that there is it's like going for a bike ride with a bunch of strangers. You may not be
Hmm.
interacting in a very detailed level while you're, looking over your handlebars and stuff, but at the end of the journey, you've done something together. And I think that there's a bond that's
Hmm.
created through sauna bathing that's special that
Yeah.
way. We are all one on the
Hmm.
bench.
Yeah, and you could also be, you don't need to be physical fit. I mean, you can have your different limitations, and it could be 100 or 10 years old. It could be female, male, or whatever. I mean, it doesn't matter. I mean, you can meet over different ages. Whatever age you have, or gender. It doesn't matter. It doesn't matter if you're a physician or painter or plumber. It doesn't. We don't talk that much about this. You can have different levels of the discussions as well, and you learn from each other. I mean, I think the
Mhm.
nudity. Do you call it nudity, or
Sure. Yeah. The
yeah?
nudity, or
I think that is of importance. Yeah.
nakedness.
Nudity.
Yeah.
Yeah. Yeah.
Yeah.
Nakedness. Yeah. That's one thing. I mean, and
Mhm.
you don't have a tag. I'm an artist, or
Right.
I'm a chef, or that's also important, I think.
If you had to guess, as a doctor yourself and someone who's impassioned about sauna, like we both are, gosh, it's a terrible question, but I want to ask it anyway. If you had to guess, mental, physical, as a percent in terms of benefits, where would you land on the numbers? What percent is physical? What percent is mental, psychological? How would that lay out in your mind?
Mm-hmm. So we tend to talk very much about the physical advantages, but I would say that the mental is as important, or the effect on the mental health is might be even greater. But I mean, because if you can lower your blood pressure, you will probably also have a positive effect on your mental health. So, well, it's also a very it is an interesting question, and I would say, I don't know, I haven't seen any studies that that try to solve this out, but I would say that we tend to focus on, as a researcher, we tend to focus very much on the physical part. But there was a nice study by Joy Hussein, and I read her paper, and she asked, usually when you do a study, you come together and you say, okay, so we try now to lower the blood pressure, and we can measure we can measure this and that, and we can measure different things. And as a researcher, you can look into that. But when she asked the sauna bathers what is important, they said, we think, if we sleep better, how it affects our pain. So, and it was totally different things from what I think the general researcher was thinking. So it is of importance to ask the people that are sauna bathing, what do you think is important? Why do you go to the sauna? And try to focus a little bit more on those questions. So I would say that mental health it might be actually bigger, because we know that it has an effect on anxiety, on depression, on sleep, and other stuff. So I think that is important, actually. Yeah.
Beautiful. Gosh, isn't that exciting that there is this thing that can affect us mentally and physically to such an extreme? For those that may have never partaken in sauna, how long have you been taking sauna, Hans?
Well, I would say approximately 55 years or more. Yeah.
Yeah. Your whole life. Were you walking? Were you sauning before you were walking?
No, not that hardcore. But I think I was like 5, 6 or something when I started to sauna bathe.
Right. So as someone as personally experienced with sauna, if you had to project, or how quickly do you think the positive effects of sauna would start to take hold for somebody that has never sauned before in their life, that may be listening to this program and say, yeah, I'm going to try this out? Would you guess, or would you surmise, or is there research like are the positive results immediate, or what would be the kind of protocol or the amount of sessions before it would really take hold, these positive physical and mental benefits?
Yeah. First, I think it's important that you don't compete in the sauna. It was crazy competitions before, and I think you should start slow and low. So, I mean, you can go into the sauna for a short time. You don't need to have that, extremely hot. It could be 50, 60 degrees, whatever it is in Fahrenheit. But and then try to put some water on the rocks but do it slowly, stay for a short time, and then you get used to it. It's a little bit like physical activity. You don't run a marathon the first day, so you need to start slowly, and I would say that you will from that you will feel the positive effect. The studies that have been performed, they have been performed with a short-term follow-up. So there's no study that have followed people for a long time. But I would say that you will feel the mental or the psychological effect pretty fast, I would say. But if you lower the blood pressure, you don't feel that much about that. Or if you lower your, let's say, cholesterol, you don't feel that. But it's positive for sure in the long term. So I would say that you probably sleep better, less maybe less anxiety, and worries and stuff. And that could be the heat, but it could also be, the social interaction and the fact that it might be meaningful to go to the sauna. And if you combine this with physical activity, then you even have, an additive effect actually. So I would say I cannot answer if it's you need to go there for 6 times, 8 times, or but I think you need to do this regularly and a couple of days a week, and probably you will feel some difference within a couple of weeks or months or so, maybe earlier. But this is also again an interesting question. Probably. What I know, no one have actually looked into that. How long time does it take? What temperature does it take? Or it's probably different for females and males, and it could be different. Due to your weight and age, and it could be so many different aspects or parameters to take into account. So. Interesting question, but I don't have a good answer, as you can hear.
Sure. Well, yeah, no, this is a question I normally ask guests at the end of the show, but as a rapid-fired question. But I'll ask it now. From a perspective of Sweden or larger, from an ISA perspective, more global perspective, what do you think is most misunderstood about sauna that you'd like others to know?
Yeah, this is a great question, and this is actually why I was interested in sauna research, because when I went down to my father, he lived in Spain, and I told him, is there any sauna here? Yeah, there's a sauna at the gym. Let's go there. And we went there, and everywhere in US, in Spain, and outside Sweden, there's big signs, if you have high blood pressure, if you have heart failure or whatever, don't go into the sauna. And if you go into the sauna, first ask your physician. And this is so misunderstood, because we know today that you lower your blood pressure. It's good for patients with heart failure, and the list, you can make this list very long, and you scare people when you write those warnings. And so this is one thing, and the other thing is ask your physician. And I can tell you that the knowledge in the healthcare sector about heat therapy is almost zero. So you will not get a proper answer. Probably the physician will say, since they don't know, they will say, well, it's better to be careful. But it's not right. I mean, if you have, if you have your high blood pressure, go into the sauna, you lower your blood pressure.
Hans, my uncle, he's 94 years old, and he's been my primary care physician my whole life. He's got a line.
Yeah,
He says, it's always the patient's fault. So, like if you get
exactly.
your knee operated on and you're sore and you go a week later, oh, you're overworking it. And then, okay, all right. So you lay on the couch, now it's sore again. You go, oh, you need to exercise it more, So we as patients get blamed for things, but you're right. I mean, this is in America. It's extremely litigious, meaning there's lawyers everywhere looking to sue. So in defense to the doctors of the world, doctors need to be very conservative about what they're telling their patients, and you're absolutely right. I mean, it's interesting to hear that even in your country, in Sweden, the idea of prescribing sauna or saying, hey, you had heart surgery, go for sauna. In America, that's like, no, you're going to get the poor doctor would probably get sued if there was the problem, because there's this causation correlation thing. Like someone was telling me in Finland, they actually have a box you can check, cause of death, and then you go down there and car accident, whatever, and then sauna is listed there. Because when you think about it, it isn't the fact that sauna causes death, but a lot of people will die in the sauna because there's 3 million saunas, and they're sauning their whole life into their 90s, and not a bad way to go out.
No, you're right. But they have looked into this actually. So it's not more common to die in the sauna compared to outside the sauna. So they have done nice studies on that. So
for sure.
But yeah.
Well, what is the interest of sauna and cold bath? Why is this interest, from your perspective? Why is this increasing worldwide?
Yeah, it's a good question, and I think I think one reason is that it's stress reduction, and what I can see today, a lot of people are so stressed, and that's one thing I think, and also a lot of people are lonely, and loneliness is a major problem. So it's a social thing, and I think it's a social thing actually, and you can make some new friends and so forth. And then the physical and mental effects. If you feel better, why don't you go there? I mean, it's the same as doing physical activity. I mean,
right.
So that's could be a reason, but it's also the relaxing, enjoying effect and all that. I think it's probably multifactorial reasons, and also it might be so it's also more and more accessible. You started this program talking about Norway, for example. And if you have a sauna everywhere, and it's a nice location, it's nice architecture, and it's the prime site. You go down to the harbor and you have this nice sauna. It's what we have in Sweden is actually cold bath houses, and they are beautiful buildings on the sea, and it's always different saunas in those cold bath houses, and then you jump into the sea. They are open the year around, and they are very popular. So you can Google on cold bath houses in Sweden, and I think that is one thing that will be built in many other countries as well. Okay. So, but anyway, I think it's many different reasons why the interest is growing, and if you and it's also if you start talking about things and it will be spread. It's cheap also, and we have those academies, and we have the International Sauna Association, and now we have SRI, and well, it's multifactorial. It's my my conclusion on this, I think.
Well done. We talked about the challenges with research, sauna and cold bathing research. I think we're good there. Is there anything more you'd like to share? You know, I kind of view it as this chicken and the egg with funding. Any other challenges come to mind that we haven't touched upon?
So I have a little bit hard to hear you now. It was my internet, I think. Sorry, Glenn.
Yeah, I was revisiting the challenges for sauna and research. We talked about funding, and we talked about a uniform standard and what I called silos. Yeah. Is there any other aspects to challenges you'd like to speak about?
Well, no, I think funding is big. Standardization is that one, and collaboration and a platform to meet. Because I mean, if you're a hematologist, you go to ASH, the American Society of Hematology. It's an annual meeting. I mean, 30,000-40,000 hematologists go there, or people go there. To be updated, to meet, to plan new studies, and we need a platform. Actually, we need this annual meeting and start to organize different groups. That really focus on cold bath, on mental health, on physical. So we need to get together. Collaboration is crucial here, I think.
Beautiful. Why would you like to prescribe sauna bathing as a complement to medication? I mean, do you see that as a possibility that some medication could be taken less or have better effect if sauna and cold were prescribed? How do you see a correlation there?
Yeah, so we have been, we have prescribed physical activity for more than 20 years in Sweden. There is a book with all the drugs where you can read how you should, dosage and so forth, the medication. But we also have physical activity where there is evidence, and there's also a book how you should use physical activity for prevention and treatment. If you have had a myocardial infarction or whatever it is. And I think, in the future, we will prescribe a lot of other things. We have for example, in Canada, they prescribe nature. And in Sweden, we have started to prescribe culture activities. In England, they can use different coordinators, so they can guide the patient. The general practitioner can guide the patient to a local coordinator, that can find a hobby or special interest for that patient. Let's say you're interested in puzzle. Well, then the coordinator helped these people to find a puzzle club. And I think, in the future, we will also prescribe contrast therapy or cold bathing or heat therapy. Yeah. Because we need to find different ways to. It could be preventive, but it could also be in addition to medical treatment. And we know that it's lower the cholesterol, it's lower the blood pressure. And if you can reduce the dosage of your medication, it would be wonderful. And if you can, even taper or stop the medication and replace that with, physical activity in combination with heat therapy or in combination with, music therapy or whatever it is. So I think we have to be much more open-minded, and I think it could be prescribed in a preventive purpose, but also as a medication. Actually, yes, I think so. But we cannot only prescribe. We need to have evidence for what we're doing, and evidence comes with research. That's why it's so important now to do research, to collect evidence, and then we can use this as a part of a prescription when we know that it is effectful. So yes, I think so in the future for certain diagnosis or for prevention. Yeah, I think so. But we can also, everything doesn't need to be prescribed. We can also use it as, as we talked about earlier, for relaxation, enjoyment, and all that, stress reduction and social as a social activity. So yeah.
Yeah. Fabulous. Couple other questions. How you doing? Did we touch? Oh, I wanted to ask you about your book. Tell us what you're working on right now.
So I wrote a book 5 years ago about in Swedish about sauna and health, and I actually now work together with an agent in Sweden, and she's interested in translating this book to other languages. So I think that is one project. Another is that I will start. Actually, another which I have just finished is it's 50 years ago we started stem cell transplantation in Sweden. So it's a book to celebrate that we have been doing this for 50 years. So that will be released in October. But the book I will just start writing is about cold bathing and health. And I'm now trying to, collect material for that book, and it will be in Swedish as well. But that's my next project that I will start here now.
Congrats! Yeah. Wow, fascinating. Well, there's this club of book writers. When you've written a book, you have appreciation to other book writers. It's a commitment and a lot of work. So I commend you for that. That's 3 book projects for you, correct?
Yeah.
Yeah. Good. Is there anything you want to ask me, or is there anything you want listeners? I got a couple of quick questions to wrap up this wonderful visit. I'd love to be on the bench with you with my handheld recorder, having this sauna talk, but this is the second best thing. There you are in your apartment in Stockholm, and here I am at our island in northern Minnesota. But I feel as if we're on the bench as close as we can with our technology. But on that note, is there anything that you want listeners to Sauna Talk know or ask to me, or anything we didn't cover that comes to mind?
No, I think we covered a lot of interesting and important stuff when it comes to sauna bathing, and we for sure we haven't got deeper into the effects on the cardio metabolic effects or the effects on dementia. So, but we know today that there is a lot of positive effects from sauna on cardiovascular diseases, on dementia, on stroke, and so forth. So there is something there that we need to try to do more research on, and to try to understand better in detail. So, but that could be another talk, I think.
I agree. Yeah, getting more in the weeds, and as we're all together, when the researchers are together, to be able to pick apart or dive into these different effects. So you're on your way to Germany and Switzerland, but think about the entire world. And I'll just ask you, if you could have a mobile sauna and bring it anywhere in the world, what's the first place that comes to mind where you'd like to go and enjoy a sauna session?
Yeah, it's an interesting question. I have a mobile sauna, and yesterday I took my friend into the mobile sauna at my summer house, and we were talking about this actually, and said, I mean, taking this mobile sauna up to the Swedish mountain, wintertime would be fabulous. Going out with a snowmobile, put the the tent there and then go from there, have it like a base camp, camping and the sauna tent, and then go for skiing. That would be so fabulous, so nice.
If you could be doing this with anybody in the world, past, present, dead, alive, aspirational, someone maybe someone that you would love, who would you like to sit on the sauna bench and have a sauna with? Anyone in the world? Who would you choose?
Oh, wow. Well, Glenn, I don't really know. One thing that should be nice, it would be to get together with, the other international sauna researchers and have this discussion in a in a big sauna. That would be so nice, I think. We have the Swedish Sauna Academy have a sauna in the northern part of Sweden, where we were on the National Sauna Day in the second Saturday in June. Actually, we were 80 people in that sauna.
Cool, great. So this vision about
all the researchers in. Yeah.
Yes, yeah. Well, maybe we should do this as part of the World Sauna Congress, right?
Exactly. Yeah.
Does Ferris nice, yeah. How about Ferris?
Perfect.
I think it's going to happen.
Yeah, I think so. Now we invite all the sauna researchers to Oslo, and we get into the sauna and start a discussion there, and the idea will be yeah. So we will have a lot of ideas, research ideas, I think.
Great. Well, Hans, thanks so much for being a guest on Sauna Talk. I'll leave you with one final question. Well, first of all, how many days a week do you sauna? Typically, how many days?
Well, I would say that I sauna between 4 and 7 days a week. I just recently came from the sauna. I went to my sauna tent yesterday, and actually the day before I went with my mother on a cruise to Finland, and I had a beautiful sauna on the ship actually.
Oh, so that's
I try to do it every day.
Yeah, great. So when it's going to be a sauna day for you, and from the morning of anticipating the sauna to the actual going to sauna, maybe preparing and lighting the stove with wood fired, the first heat up, the first splash of lolu, the steam, cool downs, all of that. If you and then when you're done, going to bed at night, when you think about that whole experience, is there a moment, or what is the moment, if you had to distill it, what is your favorite moment of sauna bathing?
Yeah, I don't know. Actually, it could be different in between different situations, but the process before organizing, heating up, and that's ritual is so fascinating if you have a wooden heated stove. But otherwise, I think putting the water on the rocks, slowly, and then just relaxing. That's the big part. I think that's amazing, really.
Thank you, Hans. What a pleasure. This is overdue. We've wanted to have this call, and I'm glad we spent some time. So I wish you great travels to the continent down south, and I can't wait for us to be together for real someday soon on the bench.
Agree. It's my pleasure. Thank you so much for having me, and so many interesting and nice questions, and I love the discussion. And as a researcher, you always get new ideas when you talk like this. So thank you, Glenn. I appreciated this very much. Thank you.
Me too. Thank you, Hans. Have a good night.